Welcome back. Now we just came from the Government Information Center where the Electoral Commission of Namibia was giving an update on the election calendar for the upcoming regional and local authority elections that are going to be in November. So we continue with Namibia Connect, and breast cancer awareness in Namibia is highlighted prominently in October, which is Breast Cancer Awareness Month. During this month, organizations like the Cancer Association of Namibia and other partners host events such as free community breast screening clinics to raise awareness and encourage early detection. Now, medical practitioner and public health expert, that is Dr. Cornelia Ndifon from Sterling Medical Center, joins us in the studio. Good morning, doctor, and welcome to Namibia Connect.
Good morning, and thank you for having me on Namibia Connect.
All right. Just to start off, talk to us about the significance, that is, of Breast Cancer Awareness Month in October, of course, and why October is dedicated to this cause.
Okay, thank you so much for that question. So I want to start by quickly saying that October, chosen as the Breast Cancer Awareness Month, it actually started in 1989. And that was just to kind of honor the research about breast cancer. Yes, so it was in 1989, and they chose October because most of that significant research happened around that time, and also to honor the earlier advocates of breast cancer. So, but why is that significant in itself? When we choose a particular month to highlight a particular disease, and in this case, breast cancer, we are trying to say that let us keep that momentum going. And during that time, we give information about risk factors, about signs and symptoms of breast cancer, about prevention modalities, and even treatment. Okay? And the overall aim is that we will encourage the public, the women in this case, to go for screening. Because with screening, it affords us early detection. And early detection means that we could do a lot more, and in some cases even cure the cancer. If we detect early, survival rates are better, meaning after the treatment, the person can live longer despite the diagnosis of breast cancer. And then we also, with the information we give, we kind of allay fears that people have and also reduce stigma. You know, we can talk about cancer. It doesn't have to be that every diagnosis of cancer is a death sentence. So during that awareness month, it brings focus on what breast cancer is. And remember, it is the commonest cancer amongst women in Namibia. So we cannot just treat it like any other cancer. There are other cancers affecting men and women, and they are rare. But in this case, breast cancer is top. And it is killing women both below 50 and above 50. And to be honest, in today's world, people are becoming leaders at 70, president at 70. Imagine having to bury somebody below the age of 50. That is not good. And because it is number one, it is a big burden on Namibia. And we need to focus on breast cancer in October. Thank you.
Doctor, what are the most common risk factors and early warning signs of breast cancer, and also just Namibia women should be aware of?
Okay. So like I said, overall, risk factors age above 50 generally. But then there are cancers that come below that age. And when the cancer, the breast cancer happens below the age of 50, there is a strong reason for that. It means that there is a hereditary factor, there is a abnormality in genes, okay? And then you find out that those women that have that cancer that early, some of them may have had their first menses, what we call menarche, before the age of 12, okay? Then for the women that get it above 50, which I said is a commoner, okay? If a woman's menstruation lasts longer than 55 years, the risk in that particular woman is even higher. Okay, so those are risk factors. Now, when it comes to early warning signs, simply everything about the breast skin and the nipple. So if a woman is having breast pain or nipple pain, the woman has something like itching, something like discharge from the nipple that is not breast milk, okay? If there is peeling of the skin, and if the skin looks like an orange skin, we call it dimpling. These are not things that you should take lightly. If you are having itching or scaling or peeling, like I'm saying, don't just go into the chemist for self-medication. If you do it once and the problem doesn't go, it is better that you go to see a doctor. And then there's also what we call a retraction of nipple, whereby the nipple it seems to be like indrawn instead of sticking out. Then there's something wrong. And then the big one, which we have always used, is breast lumps. Now, all these things don't automatically mean that you have cancer. You cannot tell yourself that you have cancer. But if you have a breast lump, nipple discharge, that's not breast milk, itching, peeling, your skin, the skin of the breast looking like an orange skin, all this should draw you to see a doctor. And it is left for the doctor now to confirm what you're saying and take history. You know, history will tell us about whether your mother or your sibling has had breast cancer, you know, what we call first degree and second degree relatives. And when they get that history and also examine you, they see with the naked eye. And if you say it's a lump, the doctor or nurse should be able to agree with you that, okay, I'm feeling that lump. And then they can take it from there. But to just stay at home, because it's breast, you cover your brassiere, you put your fancy shirt, no one is seeing, it's not good.
Indeed.
Yeah.
Doctor, let's talk about early detection of breast cancer in improving survival rates. And what screening options do we have in Namibia?
Okay, so early detection is very, very important because it simply means that either the cancer has not started to spread or it hasn't spread far enough. So with these symptoms and complaints that a woman can have, and I said, go and see a doctor. The duty of the doctor, apart from what we call clinical, that history taking and examination, is to at least start with ultrasound scan of the breast. Yeah. If there is a problem, then we can move to mammography. And if still we need to find something we are not satisfied, then we go to MRI, okay? And MRI there is kind of like, maybe some women have heavy or what we call dense breasts, and the other ones that I've mentioned may not give you all that you want, then the person can do MRI. And all of those, they are available right here in Windhoek. Okay. Yeah.
Doctor, just talking about accessibility for screening, especially for women in rural areas. Do we have that in Namibia? Are they enough in Namibia?
Okay. Plus or minus, even though I have worked in Otjiwarongo and I've worked in Rundu, and I think I've traveled to almost every region of Namibia, but I haven't gone because of breast cancer. I've gone there because of a lot of other things. So I really don't know what is happening. But what I can tell you is that there is mammography in Onanjokwe, and there is MRI in Ongwendiva Medipac, okay? But in terms of other rural, you know, when you leave these major towns like in the north, and you go to small, small districts and villages, they probably don't have ultrasound. But why I was talking about those symptoms and signs and the healthcare provider, these people are key. So for the public, the patient, the woman, if you have any of these things, go to the nearest clinic, please, and talk to the nurse. A good registered nurse should be able to say, if the patient is worried about this symptom, I should be worried too. And then get to the doctor. A good doctor should be able, like I said earlier, take a history, do the examination, and direct the patient to where they can get ultrasound. That is like the minimum basic. And I believe there is ultrasound in the different north, south, the coast, you know, of Namibia. And each of these levels, for example, the sonologist, the person that does the sonar, they should be able to know what is important, what is worrisome, and then escalate to the next level. For example, I run my practice here in Windhoek. if I say, do what I'm saying, I should immediately contact either a breast surgeon or an oncologist and say, no, I have done this sonar and this is the report I'm getting. And from what I'm seeing, this woman needs urgency. But it starts with the patient. For example, if you're in some rural places, say in Kavango West, for example, it is your breast. You are the one taking a bath. So if you see these signs and symptoms, just mention it to the nurse and doctor, depending on who is closest to you at the facility. And then they will take it from there.
Doctor, what can women do to reduce the risk? We're also just talking about health management and their lifestyles as well.
Okay, so basically 10 to 15% of breast cancer is genetic. And most things that are genetic is like you are saying, what can I really do about it? The other 85 to 90% is lifestyle related. So what women can do is to cut down on alcohol drinking, quit smoking, eat healthy, okay? If you are breastfeeding, breastfeed more and for longer. Women must keep ideal weight because overweight and obesity, they are risk factors for breast cancer. So when some of us are on the road running, people say things like, oh, doctor, you are not fat. No, we don't need to be fat to do exercise. Exercise is about overall fitness. Yeah.
Doctor, as we just round off and close off, perhaps just what role does public education and awareness play, that is in early detection and treatment of breast cancer in Namibia?
Oh, that is very important. You see, what we are doing now is public education. We are giving people information. We are telling them about early warning signs, like I've mentioned, all these skin problems, you know. If you are hearing me and you have those symptoms, just go to the nearest health facility and just mention your complaint. Don't feel stigmatized. Don't be shy, you know. The cancer is not automatically a death sentence. That's why we're saying that when you present yourself, we may just say that, thank God you came early. This is what we mean by early detection. And if it comes to the point where they have to remove the two breasts to keep you alive, to see your grandchildren, to have a PhD, to build your house. I mean, there's so much you can do being alive. Yeah. Don't run away from it. Don't say, oh, am I going to be without breast? Even people without cancer who leaves their breast and nipple on the street, that belongs to that your close heartthrob. And if you have somebody that loves you enough to say, I want you alive, even if you don't have breasts, go for it. Yeah.